Hi, this is Dr. Greg Oliver and welcome back to Fat Doctor TV. So we've had a couple of episodes where we've talked about some hormone situations, and we'll have some future episodes where we go over additional hormonal issues that can affect weight gain and lots of other health problems. But today I want to talk to you about something called omega-3 fatty acids. Now you may be familiar with this supplement. Omega-3 fatty acids are what we call essential fatty acids. Now what that means is our own body cannot manufacture these. We have to get them from an external food source. And the most common food source for these would be fish. The oily fish are the best. That would be fish like salmon, tuna, halibut, also krill, which we don't typically eat krill, but you can get krill oil, and some nut oils are high in omega-3 fatty acids. So these are polyunsaturated fatty acids. They are critically important in brain function. In the developing child, we suspect that sometimes there may be some brain abnormalities in children, or even eye abnormalities if the mother doesn't have adequate supplies of omega-3 fatty acids, and those are important for brain function. Also, we know that getting an essential number or amount of these omega-3 fatty acids is important for protecting our heart and blood vessels, reducing heart disease. We've also seen that there's been some benefit in the reduction of certain cancers, in decreasing inflammation of the body, which can affect arthritis or arthritic diseases and certain rheumatic diseases. And it's important in our cognitive and memory functions. So a deficiency of these can lead to many symptoms, including fatigue, decreased memory, dry skin and hair, depression, circulatory problems. So if you have any of those kind of symptoms, certainly getting a supply of omega-3 fatty acids may be important for you. We use them in healthcare to decrease the risk of heart disease, and we found that we can decrease triglycerides, which are too much of those are a bad fat. We also can increase our HDL. There have been some studies that show that certain types of nut oils might even decrease the bad cholesterol, or LDL. We can improve function and improve the effects of the positive effects in patients with diabetes by lowering triglycerides and increasing HDL. And we know that there's a positive effect, and some studies have shown that omega-3 fatty acids help the diabetic patient. We also know that there's a positive effect on bone health. That it improves the function of our bone metabolism and may be possibly or may affect in a positive way patients with osteopenia or osteoporosis, which is thinning out of the bones. It occurs especially in women after menopause. We also know that the omega-3 fatty acids reduce inflammation in the body and can be very effective in treatment and assistance in patients with rheumatoid arthritis, systemic lupus, or the rheumatic diseases where our own immune system attacks our bones, joints, and connective tissues. There have been some studies that show positive effect mentally with patients with depression, bipolar disease, schizophrenia. Some other areas of improvement are in inflammatory bowel disease, asthma, and in many cancers we think that the omega-3 fatty acids can be somewhat protective. Now, we want to make sure that you get the right type of omega-3 fatty acids, and an important source of that would be from fish. Fish, cold water fish, fatty fish, do give us adequate amounts of what are called EPA and DHA. These are the two common essential fatty acids that we need. Now, they're also available in fish oil capsules or krill oil capsules, and they should be in a ratio of EPA to 120 milligrams to DHA 180 milligrams. And typically those are standardized doses that you'll find over the counter. So you'll want to make sure and get those from a health food store, your pharmacy, or your physician's office. The other way to deal with this is to eat fish 2 times a week. And if you can't do that, here in the Midwest, certainly eating fresh fish is not as easy as it might be on the coasts. So we tell people if you can't get the 2 servings of fish in per week, then you'd want to take 2 to 4 grams total of fish oil, and typically it comes in a capsule. That will give you the proper amount of the EPA and DHA. So that's a brief summary of omega-3 fatty acids today. There's a lot more information on this. If you'd like further information, feel free to send us a comment or ask for information on Fat Doctor TV. We'll be glad to supply that. Or ask your physician if that might be helpful for you, or your healthcare provider, to see if they think that taking omega-3 fatty acid supplements will be beneficial to you, your health condition, and to help you live a healthier and happier life. On our dietary plans, we make sure that everyone is on 2 grams of omega-3 fatty acids a day. It is part of our dietary programs here in our office. So if you're on a dietary program where you're reducing your calories, certainly eating fish is a very healthy way to lose weight. But if you can't get the fresh fish in, then certainly you'll want to take a supplement of omega-3 fatty acids. We'll be back to some further information in the future on lots of different ways to help your health, to help you lose weight, to help you get down to your lean body weight and live a more active and healthy life. So this is Dr. Greg Oliver once again from Fat Doctor TV saying, hope I see less of you next time. You have a great day. Bye now.